Hello, welcome back to the channel. Thanks for tuning in again. This is where we talk about the real stuff happening around the country, and today's story is one that touches on both our hearts and our health system. Please stay with me until the end so you can hear where the news came from and check things out for yourself if you want. And don't forget to hit that subscribe button so you never miss the updates. So, the Department of Health has come out and said that South Africa is currently carrying the cost of treating foreign nationals in public hospitals and clinics, and yes, while they admit the system is under pressure, they also say they're sticking to the Constitution. It's a tricky situation that's been frustrating both healthcare workers and patients, especially those who've waited hours in overcrowded facilities. The health department says they're fully aware that treating everyone who walks into a clinic, especially those without documentation, is putting a strain on budgets, staff, and stock. In provinces like Gauteng and Limpopo, hospitals are seeing high volumes of patients daily, and many of them are not South African citizens. But according to our laws, especially the National Health Act, the government is obliged to provide basic health care to anyone who needs it, regardless of where they come from. Now, that means if a pregnant woman from Zimbabwe or a child from Mozambique walks into a clinic in Mzansi, they cannot be turned away. They'll be treated the same way any local patient would be, at least for primary health care like immunization, TB, HIV services, and maternity care. And while many South Africans understand this from a human rights perspective, others are raising tough questions about how sustainable it is, especially when citizens themselves are sometimes turned away because the facility has run out of medication, or there's only one doctor available for hundreds of people. Deputy Minister of Health Joe Fowler recently spoke about this. He didn't deny that the system is stretched. In fact, he acknowledged that the burden is getting heavier, but he said the department can simply break the law or ignore international obligations. According to him, South Africa has to lead with dignity, even when it's hard. Some people, especially from civic organizations and political movements, have accused the department of prioritizing foreigners over citizens. But the health department has denied this and said the problem isn't just foreign patients, it's years of poor infrastructure, limited budgets, and backlogs in hiring doctors and nurses. They say the real enemy here is the system itself, not the people using it. Still, many clinics are reporting that more than a third of their patients are foreign nationals. That's a big chunk, and the staff on the ground are the ones feeling it the most. Nurses and community health workers are saying they're exhausted. There's not enough equipment. There's not enough medicine. And there's definitely not enough support. The department says it's working on new policies, including ways to possibly recover some of the costs or get support from international donors. There's also talk of using the upcoming national health insurance system to manage the situation more fairly. But that's still a long-term plan, and people on the ground need solutions now, not 10 years from now. So, for now, the Department of Health is standing firm. They're saying, yes, we are overwhelmed, but we can't abandon people in need, no matter where they're from. They've also asked South Africans to understand that healthcare is a human right, not just a national one, and the Constitution doesn't allow for discrimination in this space. All the images you see in this video were used just for illustration and don't represent anyone involved in this specific case. The news sources used for this report include statements from the Department of Health, interviews with Deputy Minister Fowler, and reports from local South African journalists who've been following the healthcare crisis closely. Thanks so much for listening. If you found this informative, give it a like, leave a comment, and hit subscribe so you stay in the loop. And before I go, here's a little joke for you. Why did the patient bring a ladder to the clinic? Because the queues were so long, they figured they'd have a better chance climbing the system than waiting in it. Stay safe, stay kind, and I'll catch you in the next one.